First aid for chemical burn. Hello, great to see you here. Today, I want to show you how something so simple yet sometimes overlooked can be a vision saver. Everyone should know this in the event of a potentially blinding accident. We term this specific accident as chemical splash injury or chemical burn. What you do in a matter of a few minutes can spell the outcome between saving and losing the eye. Awareness about this first aid response cannot be overemphasized. Everyone should keep it tucked in their sleeves. You'll never know who, where or when the situation calls. So let's start. A chemical burn injury to the eye is a true emergency. Most of these cases happen at work. However, many also occur at home. Toddlers at times out of playful curiosity, and grown-ups, out of recklessness, or unfortunate mishap might flash some harmful liquids into one or both eyes. So what are some examples of these chemicals? Some chemicals are as mild as shampoo or a little more irritating, like pepper spray. Others can be more dangerous, like the more common household drain cleaners, oven cleaners, laundry bleaches, car battery solutions, plaster cement, fertilizers, and pesticides. So what happens when these chemicals come into contact with the eye? Every second counts during this unfortunate instant. Recognize the urgency and act as quickly as you can. The moment a drop comes in contact with the eye, pain is instant, and damage is instant. You'll immediately tear profusely and will be very hard to keep the eyes open. There will be immediate redness, irritation, and also swelling of the eyelids and blurriness of vision. There are chemicals that will melt the eye faster than others. Alkali such as pool cleaners and drainers, caustic soda, and garden lime tend to penetrate faster and deeper. Acids like sulfuric acid and car batteries are less aggressive. But regardless of the type, it's important to act quickly and wisely. Time is not on your side. Do not dilly-dally or you will end up losing the eye. So what should you do? Should you call 911 and wait for them? Or hop in your car and get to the hospital at once? Or hurry to buy some sterile eye wash? These are good. But the very first and important thing that you should never skip is to flush the eye with water. And what we really need is not necessarily sterile water, although that will be ideal. But because time is of the essence, we want to find a clean, generous water source. It can be from the faucet, water in a pail, collected rainwater, or water from the river if you're near one, or even from the pool. Almost any water is better than a chemical melting the eye away. If you don't have access to an ideal water source and it will take you longer to get some, then use whatever is at hand. You won't believe other alternatives. In the absence of clean water, you can use milk, beer, juice drinks, or iced tea. This is where best becomes the enemy of good. In a hurry is better than being medically on point. So how long do we do the washing? You can do it for at least 15 minutes or continue until you get to the doctor. Take as much of the chemical off. Use your fingers to pry open the eyes and roll the eyes around to really wash all around the eye. Remember, you cannot overwash your eyes. It's better to err on the side of caution than to be sorry later on. So finally, when you get to the hospital, the doctor may first instill an anesthetic drop to numb your eye. He may probably continue with them rinsing even up to 3 liters of water depending on whether or not pH of the eye returns to normal. He may finally then do a more thorough eye exam to assess damage to the eye and the vision. Now I'm sharing to you one of my actual cases. This is a female who accidentally dropped an antifungal liquid into her eye. The drop is a keratolytic, meaning it sloughs off thickened skin as its mode of action. The patient mistook it for a normal lubricant eye drops. Unfortunately, the bottle contained salicylic acid, linsearic acid, among others. She was instantly crying in pain, but she hurriedly rinsed her face in a tap before they finally drove to the hospital. In the hospital, I did some more rinsing before a formal eye exam. Her vision was down to a very blurry 2400. Here you can see I'm using a slit lamp with a blue filter light on. You can see some kind of yellow liquid coming out of her eye, which is the fluorescein dye. It is used to stain part of the cornea that is damaged. You can mark out areas that are injured. The yellow area seen here is the extent of damage done by the single drop. I sent her home with some antibiotics, anti-inflammatory drops, lubricants, and some pain reliever, and then I asked her to follow up. After 2 weeks, her eye was much better, and her vision was greatly improved. The cornea healed marvelously. In total, it was a combination of quick first aid on her part, judicious treatment on my part, and a grace of healing on God's part. So that's it for now. I hope you learned something from this video. Click subscribe to get more tips on how to take care of your eyes as well as tips on caring for your skin. In future videos, I will tell you how I personally got rid of the ugly flakes in my own case of dermatitis of the face. Thank you for your time and please keep safe. Pagpaling ko ing dios. Hit the like and subscribe button. Thank you.